Hello and welcome to SRG's Medicine. Today on this video on Respiratory Medicine Series, we shall be talking about sputum. So the contents of this slide are, we'll start with definition, then we'll talk about few important but subtle differences, then spontaneous versus induced versus extracted sputum, then we'll talk about the laboratory investigations which are performed with sputum, then we'll mention about the uses of sputum sample. Then finally, we'll be talking about history taking with few examples and ultimately the summary of this slide. So let's start. What is sputum? So defining sputum, we can say that sputum is a respiratory secretion which consists mostly of water and mucus. But this mucus is secreted from all parts of respiratory tract except from nasal passage. It also contains respiratory epithelium, neutrophils, macrophages, enzymes, other cells, as well as normal and pathogenic organisms. So this is the definition of sputum. So now let's talk about few important but subtle differences, because commonly we have few misconceptions that there are some differences or common things between sputum, phlegm, saliva, or mucus. But let us clear our concept on these terms. So the first thing that we'll be talking about is mucus. So mucus is a viscoelastic substance which is usually rich in glycoproteins and water. So it's a viscous substance and it is secreted by mucus secreting gland, whether they be goblet cells, Clara cells, or any other kinds of mucus secreting glands or cells. The next thing is sputum. So sputum or phlegm is the respiratory secretion except those produced from nasal passage. And saliva, on the other hand, is secretion of salivary glands, which is present mostly on the oral mucosa and some part of pharynx. And it contains electrolyte, mucus, oral epithelium, enzymes, as well as different kinds of leukocytes. So this thing will be clarified more on this slide. If we consider this large green circle to be mucus, then under it comes respiratory mucus, and under respiratory mucus, excluding the nasal mucus, comes sputum. So this is the difference between mucus, sputum, as well as saliva. So saliva doesn't come under this circle. So now talking about the differences between saliva and sputum. So why is this important? Because though the person expectorating might know whether that is saliva or sputum, or the person looking at the expectorating person might know whether the person has given saliva or sputum. But when the sample goes into lab, one doesn't know by just gross appearance whether that is saliva or sputum. So there are a few points to be noted to investigate whether that is saliva, whether the sample is contaminated by saliva or not. So the differences are, so saliva is usually clear and watery, whereas sputum is viscous and dirty appearing. So in saliva, there is presence of squamous epithelium, whereas in sputum, there is presence of pseudo-stratified ciliated columnar epithelium. This kind of epithelium is also known as a respiratory epithelium because it is present mostly in respiratory tract. Now the next thing would be, in saliva, there is absence of alveolar macrophages, whereas in sputum, there is presence of alveolar macrophages. So the last difference would be, in saliva, there is no traces of sputum sample. However, while expectorating, sputum might be contaminated by saliva. So the sample, if it is sputum, that it contains both sputum as well as salivary contents. But the quality of sputum can be measured by the amount of contamination by saliva. Now, the next thing that we will be talking here is about spontaneous versus induced versus extracted sputum. So what are these? So the first thing is spontaneous sputum. Spontaneous sputum is the sputum which is actually expectorated by the patient himself or herself naturally without the physician's aid. Whereas induced sputum is the sputum which is expectorated by the patient but with the help of physician via the use of nebulized hypertonic solutions. So in induced sputum, the patient is made to expectorate sputum. The next thing would be extracted sputum. So extracted sputum is the sputum which is not expectorated either naturally or via use of any other devices, but rather it is taken out from the respiratory tract. So the difference over here is that the cell viability and quality of spontaneous sputum is low as compared to the induced or extracted sputum. So how do we perform these kinds of things? So the first thing is that we have to tell, if possible, to the patient to expectorate sputum for test. So if it is possible and we obtain the sample, then we have to check the quality first. So I'll talk later on how to assess the quality of sputum sample, but just for now, let us understand that if it is possible, we have to ask for the sputum sample, and once the sputum sample is obtained, we have to first check the quality. And if it is up to the mark, or according to the guidelines, then we can perform further laboratory test. However, if the quality of sputum is poor, then we have to ask for another sample. So we have to retake the sample. So now if spontaneous sample expectoration by the patient is not possible, then we have to induce the sputum. So we have to perform sputum induction by nebulized inhalation of hypertonic saline. And if induction gives us the sample, then we either perform the test or retake the sample after checking the quality. But if after sputum induction, we cannot take out the sample or we cannot make the patient to expectorate, then we do not do sputum induction again. Rather, we move on to the next thing, that is either to extract a sputum or we leave the sputum examination for the current time being and perform other investigations. So, what are the laboratory investigations that can be performed with sputum? So, the first thing is gross examination. So, in this, the laboratory individual checks out what is the sputum like in gross examination, whether it is serous, mucoid, or purulent, whether it is blood stained or whether it is of any other colors, and what are its order. So anything that is seen by gross examination is noted first. After that, we perform quality check. On quality checking, the normal guideline or widely accepted guideline says that for a sputum to be of good quality to perform further laboratory investigation, there must be less than 25 oral epithelium per low power field, which means there must be less than 25 squamous epithelium per low power field. And some guidelines also refer to check the neutrophils and macrophages number. That is, greater than 25 neutrophils or greater than 10 macrophages per low power field must be there for proceeding on with the further investigation. However, this is not well accepted everywhere. The next thing is wet mount microscopy. So after performing gross examination and quality check, wet mount microscopy is done by making smear of sputum. And it is done for noting the parasites. So commonly paragonymous and other flukes infestations of lung. The next thing would be staining. Staining is done according to requirement. For example, gram staining is done for bacterial infection, whereas Giemsa staining for fungal infection, and Papa Nicolau staining for neoplastic screening. The next thing is culture. And the next thing and the final thing that can be done with sputum is PCR testing or direct fluorescent antibody testing. So this was about laboratory investigation with sputum. Now we'll be talking about the uses of sputum sample. So it can be done for screening neoplasia. It can be done for diagnosing diseases such as tuberculosis, asthma. It can also be used for determining which is the best therapeutic modality for a given patient. So it is also useful for personalized medicine. Then the next thing would be for determining the effectiveness of ongoing treatment, whether the ongoing treatment is effective for the patient or not. And the final thing would be for the prognosis of disease. So we can use it for determining what will be the prognosis of the disease. So now we'll talk about history taking in brief. So what are the questions that we have to ask to a patient with sputum? So the first thing is amount, because normally a normal individual expectorates around 1 teaspoonful of sputum. So if it is greater than that, then we have to consider about some pathologic process ongoing in the patient. So we have to firstly ask what is the amount of sputum. Usually the patient answers in amount, whether that could be teaspoonful or in the egg cupful, and then we have to evaluate it. Now the next question we'll be asking is consistency. So what is the type of sputum, whether it is serous or mucus, serous or mucoid? And normally the sputum is seromucoid, that is, it contains some parts of clear watery fluid along with some part of mucoid substances. And the next thing that we'll be asking, what's the color of the sputum and whether there is presence of blood. Normally sputum must be whitish in color or sometimes creamy in color. But in different kinds of infection, there are different kinds of color of sputum. And hemoptysis is the presence of blood in sputum, and it has to be evaluated quite seriously. And the next thing would be how smell and taste. Normally, the sputum is odorless and slimy in taste. However, in the cases of anaerobic infection, it is quite offensive. So that is a important clue that we have to find out in smell or taste. And the next thing we'll be asking about is what is the duration, whether the excessive sputum has started just recently or it has been longer duration with these kind of sputum, or whether the character of sputum has changed recently. So that's about duration. So acute or chronic. Now the next thing would be what is the most common timing of sputum? That is whether the patient expectorates more during the morning or during the night hour. That also gives us a view on the pathologic process ongoing in the patient. And the next thing we'd be asking about is associated factor. So what are the factors associated with sputum? So let us start with few examples. So if the sputum is copious and mucopurulent, then we consider bronchiectasis. If it is red currant jelly in appearance, then we consider Klebsiella infection. If it is sticky and rusty in color, then we consider pneumococcal infection. If it is frothy and pink, we consider pulmonary edema or cardiac failure. If it is offensive and greenish to yellowish in color, then we consider it to be anaerobic infection. If it is sticky with large plugs, we have to consider allergic bronchopulmonary aspergillosis. And if it is copious and serous, then we consider about bronchoalveolar carcinoma or any kinds of irritants. So let's conclude this video with summary. Sputum is a seromucous respiratory secretion except that from nasal passage. Sputum, saliva, and mucus are different things. And sputum, for undergoing various laboratory diagnostic tests, whether they be PCR or any other kinds of test, can be obtained via spontaneous, induction, or extraction. And finally, we talked history taking. History taking can illuminate on the probable cause of sputum production. And laboratory investigation of sputum can assist in every step from screening to treatment and prognosis. Hope you enjoyed it. Thank you. Please do comment.